purpose of this video is to explain the need for patient lifts, what patient lifts are, and the advantages and disadvantages they pose for nurses and patients.
Nurses injure their backs frequently due to manually lifting patients. It is reported that 52% of nurses complain of chronic back pain and injuries. These injuries can debilitate nurses and cause them to be unable to perform their jobs adequately. This problem can be solved with the use of patient lifts.
I really hurt my back yesterday lifting one of my patients.
Why don't you use a patient lift next time?
What's a patient lift?
A patient lift is a mechanically powered device that helps move patients from beds, wheelchairs, showers, to other services, helping reduce our strain on our backs. The 4 types of patient lifts that we have are a stand assist, a mobile, a wall, and a ceiling lift.
Okay, I think I'll try using one of them.
Patients benefit from the use of patient lifts as opposed to manual lifting done by nurses. Patients, especially those in rehab facilities, can gain a sense of independence by being able to move themselves in and out of bed, which boosts their confidence. Also, patient lifts decrease the risk for further injury, especially for patients with severe injuries such as spinal cord injuries or complex bone fractures.
Hi, my name is Morgan, and I'm a nurse here at the Veterans Ward of the hospital specializing in rehabilitation. I frequently use patient lifts to move my patients because 3 years ago I was manually lifting a patient and I dropped them, and fortunately the patient wasn't injured, but I did have to do 3 months of physical therapy to fix a strained muscle in my back and was unable to do my job fully. Now with patient lifts, I don't have to worry about re-injuring that muscle. These patient lifts give me a peace of mind, knowing that I don't have to worry about dropping another patient. That's giving me confidence to do my job better.
Hi, my name is Nicole and I work with Nurse Morgan. Since I learned about patient lifts, I have begun using them with my patients a lot. Although these lifts are useful and help take the strain off of my back when I need to move a patient, I have noticed a few disadvantages about using the lifts. I think the most prevalent disadvantage is the time that the lifts take compared to moving manually. Between the time it takes to place the patient in the sling, allow the lift to transport, and then remove the patient from the sling, it certainly takes a lot longer than manually lifting. Especially during a busy shift with a lot of patients to attend to, it can be stressful to be spending so much time moving a patient when I know many other patients need help. Also, it can be really difficult to find the patient list sometimes, and I often have to ask other staff where they think one is. However, although I'll admit that manual lifting is a lot faster and more convenient than the lifts, I definitely use the lifts because I value the safety of my patients and of myself.
Overall, although patient lifts are associated with some disadvantages, they are known to significantly reduce injuries among nurses and improve patient care, essentially reducing the likelihood of errors while transporting patients. Patient lifts are expected to become used more frequently with improved training, familiarity, and availability in many healthcare facilities. As patient lifts become more prevalent throughout the nation, the injuries among nurses will continue to decline, leading to a better environment for both nurses and patients and improving patient care as a whole.